Hello everyone, my name is Keith Slayden. I'm a co-curator for Retina Rocks and practice currently at Bennett and Bloom Eye Centers in Louisville, Kentucky. Here at Retina Rocks, we just wanted to give you guys a case once a month just to kind of challenge you and keep you on your toes. Today's case involves major vision problems for a new mom. This patient presented to clinic with vision of counting fingers bilaterally. She was diagnosed with toxemia of pregnancy, otherwise known as preeclampsia, before delivery, with rapid bilateral vision loss and severely elevated blood pressure. We examined her in our clinic 10 days postpartum. Anterior segment findings were completely unremarkable. Fundus examination showed multiple patches of creamy white ischemic RPE and outer retina scattered throughout both posterior poles. At Retina Rocks, we heavily stress knowing the anatomy of an OCT scan so we can adequately describe what is being affected and appropriately diagnose the pathology. OCT scanning showed normal inner retinal bands extending from the internal limiting membrane to the inner nuclear layer, marked by the red arrows. But the photoreceptor layers showed multiple additional hypo and hyperreflective bands, outer retinal disorganization, retinal edema, thickened RPE, which is marked by the yellow arrows, and RPE loss with visible Brooks membrane, which is marked with the orange arrow. Toxemia causes choroidal ischemia with secondary RPE dysfunction, which can cause exudative retinal detachments. Outer retinal ischemia causes these bizarre and pathognomonic OCT changes. 1 month later, our patient's vision remarkably improved to 20/25 bilaterally. The creamy multifocal lesions resolved with residual pigmentary changes. The prior OCT outer retinal changes resolved with residual outer retinal and RPE atrophy. Preeclampsia, which usually develops in the third trimester, manifests as severe hypertension, swelling of the legs, feet, and hands, and proteinuria. When seizures develop, the condition is called eclampsia. This may lead to serious and possibly fatal effects for both the mother and the child. Patients may develop hypertensive retinopathy as well. Choroidal ischemia can cause infarction of the RPE with exudative and hemorrhagic retinal detachment. These changes usually rapidly resolve with delivery, although they can cause chorioretinal changes mimicking macular and retinal dystrophies. So what are the key things that you should take from this case? Number 1, if you examine someone who is pregnant with these creamy lesions or severe hemorrhaging in their eyes, make sure to check their blood pressure and either connect with their OBGYN or send the patient to the ER. Number 2, these lesions resolve once the blood pressure is under control, and if treated properly, they will maintain relatively normal vision. Number 3, if you see someone in their 50s plus with weird pattern-like dystrophy changes, ask if they had a history of preeclampsia. It could explain the appearance of their abnormal retina. Thanks for tuning in. We will see you all next month. Please visit our website, www.retinarocks.org, for more information and follow us on Instagram at Retina Rocks, retina.rocks. Thanks. Bye.